The Community Partnership Fund is part of the digital strategy, New Zealand's plan for our digital future. Under the Community Partnership Fund, communities define their own ICT needs and then applied through a contestable process. The Community Partnership Fund is a great example of community, business and government working together to develop regional and national ICT initiatives for New Zealand.
Well, Telepaeds was started in 1999 after a review of the tertiary services in New Zealand, and they decided that equity of access for children, irrespective of location, was a key performance indicator for health. Initially it was quite a cool toy for people to use, as technology often happens, but as we went along and came further and further down the track, it's become a core component of health professionals' everyday work life.
Well, we entered into the digital strategy community partnership with Telepaeds as our partner. We support families who have children and other family members with disabilities and special needs. Connecting up for parents or parents meeting with other parents via the video conferencing.
New Zealand Telepaediatrics has been used to provide care directly to children in their own homes, where the video conferencing unit has been set up in the child's home. And this has been particularly useful for children in remote areas of New Zealand. And it saves the children coming to the tertiary service. In fact, we take the tertiary service to where the child and the family are.
We tailor each solution to what a user's needs are. It's nothing out of the box. We don't turn up and say, this is it, away you go. We ask the user, what do you want to do with it? How often do you want to do it? Do you want to share imaging? Do you want to share slides? It doesn't matter what they want to do. We tailor a solution to them. As
a manager of an organisation, national organisation, where I have something like 12 to 14 staff scattered throughout the country, from Invercargill to Kaitaia, just connecting up with staff, supporting them, has just been absolutely invaluable.
The New Zealand Telepaediatric service and the video conferencing service itself is really easy to use. The technology has changed dramatically in the 8 years that I've been involved with it, and now it's very simple to use. It's just a matter of turning the equipment on really and dialing the number that you know to dial, and we just link really easily with children and their families, with health professionals. We can link as often as they need to, and I think that it makes the contact that we have with families I think so much more beneficial, in that we can provide care as they want it to be provided. It's like we are in their own home, and it's like they are in the hospital because they see us where we're at, and we can provide that care directly to where they are.
The isolation is the major thing for families with disabled children, and that you're always the odd family out in the neighbourhood, in the school, wherever, but to be able to know that there's other people out there and to actually see them and connect with them and form a proper relationship is just absolutely marvellous.
I think the future of Telepaeds for palliative care service is that we're going to be able to provide a lot more support to families where they are, and to reduce the travel, reduce for them, and reduce, I guess, also increase the support that they get and the level of support that they can get in their own communities. And I think in the future we will be able to do that more and more. And I think as far as education and networking going, I would really like to see health professionals around the country working a lot more closely together, because I think as we do that, we will improve the care that we provide to children and their families across the country, and maybe even internationally as well.